Where are clinics most financially exposed right now without realizing it?
Um, Good question. I approach that question from just kind of a general sense. I think having been a practice owner and been caught in the daily whirlwind of treating patients in life, it's not setting time aside to plan. I think that's where you're really exposed. You have to. If I would encourage anyone here, I'm a big believer in APTA membership, your state membership, PPS membership. There's a tremendous number of resources that can really help over time. And I'm glad I leaned on some people as I was making mistakes along the way and learning. But one thing I learned the hard way was to make time to plan, make time to work on your practice, not just in your practice. I know that sounds a little cliche, and it is, but it's so very true. Plan. You can make time to plan for compliance. You can make time to plan for clinical education. You can make time to plan for front office education, but you prioritize. You can't do it all at once, but you have to set priorities, have a goal, plan, and then you can communicate those goals to the remainder of your staff, and you can put a plan in place to actually work towards those goals. Setting a time to say plan, and again, I know clinic owners, and I talk with so many every single week. I can't because, and it's generally patient. I got to get all the patients in again, I got all the patients in again. I guarantee you that the one extra patient that you see over lunch or that you're working at the end of the day, that 1 hour of revenue is not going to offset the lack of planning for the future and coordination. You will greatly benefit from setting aside time to plan in a coordinated effort, no matter what size your organization is.
Amen.
That's great. Mary, final question for you. What systems need to be solid before a practice considers growth or expansion?
Well, the first thing I want to say is if your existing practice is compliant and has a stable foundation, you're on the right foot. If that foundation is fragile, you better clean it up before you try to start growing and adding. Again, appoint an accountable individual to help you develop and monitor and guide that expansion. You want to recognize that when you expand, you have hiring and onboarding that scales. And the more people, the more potential errors, the more need for education, the more opportunity for non-compliant behavior based on their previous perceptions or conditions. So you need to be aware of that. Obviously, policies and procedures need to be consistent to represent that growth, because you can't just keep a policy in place that was built for a small practice when you have many other things to consider. Educating the staff on your goals and objectives is key, so they'll help you with that growth. Your internal controls and audits to prevent errors and fraud. The monitoring and auditing, I can't say enough about that. And finally, looking at the quality of the growth. And if you need to take corrective action, that it is done in a timely and comprehensive fashion.